Hi, my name is Shirley Hyra. I'm a health promotion coordinator with Prairie Mountain Health, and I also help to coordinate the Craving Change program here in the region. Today, I'm joined with Michelle Deppner from my health team, who also is a facilitator with Craving Change. And together, we've joined forces to do a bit of a Q&A, or a question and answer interview, to give you some information about the Craving Change program in our region, and with the hope that you will become more knowledgeable about the program and hopefully pique your curiosity about joining a course in the near future. So welcome, Michelle. So with that, Michelle, I'm just wondering if you could provide our viewers with a little bit of an overview of what Craving Change is all about and what folks might learn taking this course in Prairie Mountain.
Yeah, sure. So I'm a registered dietitian with my health team, and I've had the pleasure of facilitating Craving Change now for over 7 years, and it's been offered in Westman for over 10. Part of Craving Change is really discovering what problematic eating is for the individual participant, and then learning how we can use certain strategies to improve eating behaviors and get to the heart of how to make those changes happen.
Okay, and so with that, if somebody was thinking about, well, you know what, I know what to eat, but I just can't seem to fit this healthy approach to my eating. I struggle with my eating, I'm an emotional eater. Are these some of the motivations that people might feel like they want to come to a program? They're just not sure, like, they have that knowledge, but they're just not sure where to go with it if they're struggling with their eating behaviors.
Yeah, that's exactly it. Craving Change isn't about what to eat or how much of a certain food you should eat. It's really about trying to take the knowledge that the person already has about healthy eating for them and then translate it into action. And so they use what's called skill power rather than what people are leaning on so many times and coming into offices with their doctor or their nurse or their dietitian and saying, well, I just need more willpower and then I can make these changes. But really, Craving Change is about building the skills and recognizing what's going on in our environment that makes change hard.
So with that environment piece, what kinds of influences are impacting people's eating behaviors?
Yeah. So our environment plays a big part in how successful we are with change. Many people take it upon themselves and feel like there's something wrong with them, that it's making it difficult for them to eat in a healthy way. Craving Change encourages us to look at our environment and how it's set up that might make it more challenging. Some of the things that come up during our group brainstorming are things like food is big business and it's everywhere. So places where you never used to be able to buy food, now it's really common that food's accessible in places like hardware stores or 24 hours a day in restaurants or with delivery or now curbside pickup. So food is very accessible in our environment. And so we're making well over 200 food decisions in the day without often thinking very hard about them. Other environmental cues that people see are that portion sizes have changed or packaging sizes. And when things are bought in bigger packages, we tend to eat more. And so being aware of how these things within our environment cue us to eat in a problematic way is really important to setting ourselves up for success with eating. There's also the environment of our body, and Craving Change does talk a little bit about that too. So hunger cues and really getting to the heart of why am I eating right now? Is my stomach actually telling me that I'm hungry, or is this more about an emotion or a heart hunger is the language that the program uses.
So if people are uncovering some of these triggers that are leading them to feel uncomfortable with their eating behaviors, how can Craving Change help somebody kind of start making those healthy lifestyle behavior or healthy eating behavior changes?
So session 1 of this 3-part workshop is really focused on identifying what are your triggers for problematic eating. And that's going to be as individual as the person that comes to the program. So that session 1 is really focused on identifying where the problem lies. And then in sessions 2 and 3, we work on what's a buffet of options that Craving Change has put together. And so we use strategies like an 80-20 approach, so that we're looking at 80% of the time making choices that might line up with the instructions from your family doctor or from a dietitian or what you feel is best practice. And then 20% of the time enjoying foods that might not fit into that, but doing so without guilt or shame or blame. So there's an 80-20 approach that we talk about. We also take a look at things like distraction, ambushing triggers, so being aware of when you're more vulnerable to problematic eating and when you might be able to do something about that. Participants have shared with me that some ways that they've done that is actually if they struggle at 5 o'clock, they're coming home from work, they've been really busy and they're hungry, and they have a hard time just driving down 18th and missing the fast food restaurants or not overdoing it when they buy their groceries, is that they'll ambush that trigger time by planning a snack.
Okay.
And that's just one example of some of those tools that we go through. And there's well over 10 different strategies. And we encourage people to try these strategies between the sessions to see which ones work for them. And then not every strategy works for every participant.
So the change buffet is something that gives them a lot of different tools to try and overcome some of those problematic times for people. What about emotions? Like, I've often heard that folks will say, you know, I just eat because I'm bored. So how do we help folks that are maybe thinking are eating for reasons such as, you know, boredom, or maybe they're feeling low or down? How can Craving Change help in those circumstances?
That's where Craving Change really looks at people being able to identify what they're feeling and where their trigger lies. So they have a really interesting part of the workshop is an emotions inventory, where people go through and really be able to label, what is the feeling that I'm having right now? And what other than food could I be doing to fill that time? And boredom or boredom in the evening is a really common concern that shows up for participants, particularly in the winter or recently with pandemic restrictions. That was a time where people were really struggling with emotional eating, particularly out of boredom. And so identifying what we're feeling, and then often distraction is something that people will put into play there.
Sounds like people will have a whole toolbox of different strategies and really learn how complex our eating is. So it's hard not to speak about the pandemic and how programs have changed our delivery here in Prairie Mountain Health. We're wearing masks today. And how has Craving Change been impacted by COVID-19, given the delivery of the program used to be in person?
Yes, so we have been able to pivot just like many other organizations and programs have. And so we're using a Microsoft Teams platform to offer this session virtually. And it's limited to 8 participants per session. But what it's done is really opened the doors for participants all across the region to join together and participate in these sessions. We're lucky to have such a varied schedule. There are sessions in the morning, afternoon, and evening times throughout the year where people can join in now virtually, which has been a great addition. Honestly, as a facilitator, I was curious of how it would go because of how wonderful I've seen in-person connections happen during Craving Change. There's always so much chatter and sharing during the session or before it starts or while breaks are happening that I just didn't feel like we could get that virtually. And I'm happy to say that I was really wrong. and that the feedback we've been getting is that the virtual program is running well, and for many people has worked better than in-person sessions to connect them, because maybe they live in a more remote part of the region. We didn't have to worry about travel cancellations this winter because of weather. So yeah, it's been a great addition with the Microsoft Teams.
So if a person was interested in participating in Craving Change in Prairie Mountain Health, how would they go about registering?
So we have a 1-800 number that people can call and self-register. So it's not something that you need a referral for, or you don't need to see a healthcare provider to get in touch with the program. Anybody that's an adult in Prairie Mountain Health can self-refer and register. And I'm just going to check our contact number here, and it's 1-877-509-7852. And you can learn more about when the classes are being offered and how to get yourself set up.
That's great. Well, we hope that this has piqued your interest, and we hope to see you at a future Craving Change session here in Prairie Mountain Health.